The Hall Commission was set up by John Diefenbaker's conservative government, and they were meant to propose something that looked like Obamacare in the States, something that would largely be a boon for the private medical insurance industry, but would require almost everybody to enroll. And that's not what came out of it. So you would think, actually, that quite a lot of ordinary people would want to appear before this commission, but actually only one did, at least on the side of people supporting a public insurance program. And I'll try and explain why. Anyway, the person who showed up was a woman named Marguerite Miles, and she was from Toronto. She was the mother of 2 kids, one of whom had developed severe asthma in 1956, so that's 5 years before she was appearing before the commission. So she was forced to go on social assistance in order to pay the approximately $2,000 per year needed to deal with her child's illness. Well, even now, $2,000 a year to pay for a kid's illness, could be considerable for lots of people. In 1956, $2,000 per year would be 2/3 of the average household income in Canada. So, so most people wouldn't have been able to handle this. I was 7 years old in 1956 and also had asthma, and I didn't get much treatment. I mean, my dad was a railway worker, and it was a big family. Anyway, finally in 1961, she qualified for mother's allowance, which paid a bit more. But the allowance did not cover the $50 per month for medications that her son's asthma required. So $50 a month, that's $600 a year in 1961. By 1961, with inflation and with some increase in the standard of living, an average income would have probably been about $4,000. She would have been well below that on a mother's allowance. So anyway, she took a job. They paid her $14 a week in violation of the mother's allowance rules. When you were on mother's allowance, you weren't supposed to be working. So she's caught. She's cut off the mother's allowance. And now the allergist continued to care for her child without payment while she tried to raise the money by making ultimately fruitless contacts with the Red Cross, the Department of Public Health, the Department of Welfare, the Social Planning Council. In those days, if you were cut off welfare, trying to get money to pay for health, it was very difficult. Anyway, at least in the view of reporters covering her speech, Miles implied that the doctor gave less attention to her son when it became clear that the family was obviously penniless. It's actually not what she said, but it was what the media read into it. Anyway, the doctor in question responded by basically saying that she had lied, that he had treated her kid just the same whether he was on welfare, she was on welfare or not. Anyway, the likelihood is that Canadians who were not well served by the medical system were far too intimidated by doctors to go before a royal commission and publicly denounce individual doctors or the existing medical system. That would actually still be true. And now people were allowed to write to the commissioners privately, but none did. The link between literacy and poverty was high, and so it's hardly a surprise that that didn't happen. So in a direct way, the commissioners didn't hear from the poorest Canadians. They really didn't hear much from the 80% of Canadians who wanted universal medical care. You read as I did, if you read all the testimony before this Royal Commission, you would think that most Canadians were opposed to this thing. You had the Canadian Chamber of Commerce, every Chamber of Commerce across the country testifying. You had the Canadian Medical Association and all the little medical associations from across the country. You had the dentists, the pharmacists. You got the impression nobody wanted this, But indirectly, the ordinary people did have their voices heard. And I've argued elsewhere that the poor working people and farmers as individuals had their voices put forward by organizations to some extent. Workers' interests were best put forward by the trade unions, And basically what the trade unions did was to demolish the claims of private industry and the physicians that, that they had these great plans. Because the argument that the right wing in this country was trying to make was that there's no need for this, a government program. You've got, this was a period of relative prosperity, of course. The period from 1945 to 1975. On the whole, things were getting better for many people in the country. Not everybody by any means. But so the argument was, look, you've got, at that time, a pretty strong trade union movement. They're negotiating all of these agreements for their members. You've got lots of middle-class people, they can afford, to buy this on their own. There's perhaps, they said, maybe 15% of the population who can't afford to cover their own medical bills. So we can have a program, through social assistance that looks after that group, kind of like Medicaid in the States. So this was what they hoped the Hall Commission would support. But the trade unions said, actually, the coverage that we've been able to negotiate is very porous. That it doesn't cover preventive health care, it doesn't cover mental health, there's lots of co-pays, lots of dentistry isn't covered. In fact, these private plans are not very good for ordinary workers. So that was one group, trying to demolish the claims of the medical profession and private industry. Now, as for the poor, their interests, I would argue, were best expressed, if in careful ways, by the social workers. Now, Colleen Lundy here and Therese Jennison have argued in 100 Years of Social Work, about which you'll hear more tomorrow, that the Canadian Association of Social Workers provided a mediocre brief to the commissioners, more focused on expanding social services than on the issue of universally available medical care. And that's certainly true. The brief was pretty bad. But it's important nonetheless to point out that the social workers were actually the only professional group related, well, actually the only professional group, period. I was going to say related to health, but they were the only profession who came out in clear support of a comprehensive state-run universal medical program without deterrent fees. The major physicians' organizations were dead against such a program. And interestingly, because now, of course, nurses are a group that are very supportive of Medicare, they were studiously neutral. I read all of the many presentations by nurses groups, and none of them, was willing to come out in support of a state system. They just talked about what things, insurance should cover, but we're not willing to talk private versus public. Okay, so anyway, the CASW responses to commissioners' questions, actually, though, were likely more effective than their brief, which seemed to be mostly interested in creating more social work jobs. The commissioners, interested in the physician and Chamber of Commerce model, in which only the destitute would receive state medical care and everyone else would purchase private insurance, asked why the social workers rejected this model. So Ms. Kay Taggart, one of the people in the CSW group, noted with reference to the poor that, quote, "It is our experience with them that many of them, because of lack of money, fail to get health services. They may get emergency medical care with acute illness, but if they do not have the money to pay the doctor, first of all, they would be reluctant to seek his assistance." So that's important, that in fact, when you have a system where, some people have insurance and feel the right to go to a doctor, other people who don't have any kind of coverage are very reluctant to go, even if in theory a doctor is not supposed to refuse you service. In fact, they would refuse you service. You'd have to go to emergency at a hospital, and for a lot of things, of course, that's not where you're going to go. Ms. B. Michael added that failing to provide full medical coverage to people of middle means, who in theory might have enough income to pay for medical insurance, would also be an error. And she said, quote, "I think we find a lot of parents, mothers and fathers, that did not want to seek medical care because it is going to deprive their children. It is going to come out of the food budget or something like this. A mother who has heavy medical expenses may feel very guilty about this if her family are suffering on account of it. And we run into this, unquote. Asked by Hall if it would not be enough to simply add a program for those unable to obtain coverage in the existing system, Trevor Pierce responded in the negative, emphasizing a universal state program, quote, because we feel that this would avoid the placing of citizens in different categories, related, for instance, to their ability to purchase service. In other words, the only way to remove a stigma is to have the same program for everybody. So the CSW brief and the presenter's answers gave no examples to buttress the case for socialized medicine. But local welfare councils, while generally shying away as much as the CASW from radical theoretical analyses of Canadian society, demonstrated rather forcefully with casework examples that the existing free enterprise medical system was failing the people with whom they worked. The Welfare Council of Ottawa brief, which presented case histories from Ottawa Civic Hospital, was the most detailed. It gave examples like this one. A 30-year-old deserted mother of 5 children had been attending their medical clinic because of stomach pains. Now, her digestive problems were diagnosed as resulting from a lack of teeth. This is something that's often the case. We still don't have dental care coverage, but if your teeth are not in good shape, your overall health is going to be screwed. Anyway, so she was had to have her teeth extracted as a result. This was very common at that point. Both of my parents, at the age of 36, had their teeth extracted because it was just too expensive, to actually look after your teeth. Now, quote, the hospital social service department is working hard to find a service club to take on this problem as a service project, but it is now weeks since it was medically recommended that this patient be supplied with dentures, unquote, noted the council. Then there was the G family. Though the father of this family of 5 children had an above average income, 4 of the children had cystic fibrosis. The retail cost of drugs required for these children would absorb 50% of this family's income. It's just the way it works. Even if you have a high income, you run into certain kinds of medical problems, you can be broke. That's the whole idea of insurance, is to guard against that. Now, they had friends in the medical community who were helping to reduce the prescription drug bill. But as the Welfare Council pointed out, most families have no such resources. And they concluded, it is extremely difficult to separate the medical and health needs of the indigent and medically indigent from the population as a whole. Basically, their needs are the same. They require the same facilities and services. Many people in middle income brackets who would not be considered medically indigent may face crippling expenses for medical care. And they added, equal health services for everyone are essential if full use is to be made of medical advances. An overall plan of prepaid health care should provide for universal coverage, quality services, efficient administration, and equitable sharing of financial costs. So, throughout the 20th century, as Jennison and Lundy quite rightly argue, social workers as a profession clung to reformist views and did not sufficiently challenge the capitalist system that was at the root of the problems that most of the clients faced. Now, it's hardly surprising, nonetheless, that given that most social workers were employed either directly or indirectly by the state or by social agencies controlled by the local bourgeoisie, and hostile to any suggestions that poverty and economic instability were systemic as opposed to the consequences of individual failures, it's not surprising, given that rather important fact, that social workers were not going to be, using radical language. It's also important to think a bit about the origins of social work. Social work had conservative origins in the 19th century charity organization societies. There was a German organization that was, in a sense, the first social work organization, and it was copied in 1869 in England by the Charity Organization Society. And it was formed with the aim of doing casework with individual applicants for poor law aid to determine scientifically, in quotes, whether they were deserving recipients of outdoor aid or should be confined to the workhouse or the poorhouse. Working with the poor law boards, the COSs provided early instances of supposedly trained social workers of a very conservative kind. Workers focused purely on the attributes of individual destitute people, but oblivious to the impact of the trade cycle and the operations of capitalism more generally on people's employment prospects. So basically, you know, at least in many respects, the origins of social work are in social control, not social justice. The COS model eventually faced rivalry from settlement houses. And actually the first settlement house, Toynbee House in London, was a men's effort to change the values and behavior of the poor so they could succeed in the capitalist economy. So really not very different than the COS. But Hull House, opened in Chicago in 1889 by Jane Addams, became the first of settlement houses where social workers tried to learn from the poor and to empower them to make decisions that would improve their lives. Addams and other settlement house leaders were hardly revolutionaries. While they rejected the COS notion that the poor were responsible for their poverty, they worked for specific legislative reforms rather than demanding an upending of the existing economic and political systems. Nonetheless, even if we'd rather that they had presented a more radical program, we should never fudge over differences between reformists who recognize social causes of poverty and social responsibility for helping the destitute on the one hand, and individualists who ascribe most problems to individual deficits and preach adapting individuals to the system. In social work's darkest hour internationally, that approach could lead to support for Nazi eugenics policies of forced sterilization of people deemed physically or mentally unfit to be parents. Altogether, between 200,000 and 350,000 Germans became victims of the Nazi eugenics policy. Social workers throughout Germany adapted to these harsh policies with almost no protest, and in fact, existing ideas amongst German social workers about social hygiene paved the way for acceptance of Nazi cruelty. The social hygiene proponents blamed the alleged moral degeneration of individuals for rising unemployment rather than focusing on structural explanations. So the early social work profession in Canada, I can claim that there were any Nazis among social workers in Canada, but there were certainly people who, you know, had this notion that basically the poor were poor because they weren't moral, you know, they lacked morality. That had nothing to do with the social structure. The early social work profession in Canada was dominated by COS followers, who were more likely to be welcomed by employers of social workers than the reform-minded settlement house workers. Charlotte Whitten, during her long years as executive director of the Canadian Council on Child Welfare, which then became the Canadian Welfare Council, she was in charge from 1920 to 1941, and in her post-CWC career, came to typify the kind of social worker whom the Canadian establishment could embrace. Whitten was an individualist and a racist, with little interest in understanding the social causes of destitution. She was more eager to press the case for social aid for families who met her criteria for requiring temporary assistance than her critics might like to admit. So, you know, on social assistance, she wasn't terrible, but social assistance was all she believed in, and it of course would create all these jobs for social workers who would judge people. But on the whole, she's rightly viewed as a social reactionary who opposed most forms of social insurance on the grounds that they provided disincentives to work, and implicitly because they reduced the need for trained social workers to carry out supposedly scientific inquisitions as to whether recipients of aid could look after themselves without support. That could reduce the perceived need for social workers both by charitable and public organizations. So that career-oriented way of thinking persisted in the CASW, though even that organization, with its focus on emphasizing professionalization of social workers, did support health insurance by the time of the Hall Commission, alone among organizations and health professionals, as I said. But again, as the Hall Commission testimony suggests, an emerging philosophy of social determinants of health, and with it, notions that universal government programs, or at least expansion of programs, might help the disadvantaged, was emerging in important organizations where social workers dominated. And the rest of this paper is devoted to the evolution of that philosophy and programs for implementing it, though, as I suggest, most of these organizations were not willing to jeopardize funding by going beyond unspoken but well understood boundaries in their advocacy. And for the period I cover ends about 1980, as the rise of neoliberalism forced greater soul-searching about the efficacy of incremental reforms, an issue that most social workers had avoided earlier because they believed that such an approach had resulted in some advances in the past and was compatible with holding on to their jobs. One way of looking at that, particularly in the period from 1945 to 75, where there was a general acceptance of the need for social reform. And as I argued in my first book, Business and Social Reform in the 30s, by the Depression and then the war created a situation where it was very difficult for the ruling class to completely ignore demands for reform. The Depression suggested that the capitalist system doesn't work. And then you got the war, which in many ways was the result of that breakdown in capitalism during the 30s. And during the war, people everywhere, said, well, the government seems to be very good at planning for the war. Everybody's working, and they're controlling prices and whatnot. Why is this not possible in peacetime? And so there was growing support for socialism during the war. And by socialism in the pre-war period, what that largely meant was state ownership of all industry. And so the capitalists were quite concerned, as were the political parties that represented them. So, so there was this kind of promise that bit by bit after the war that things were going to get better. So gradually, though, by the late 70s, early 80s, and for reasons I won't much discuss a little bit later, if I finish on time, you could talk a bit about that. That fear of particularly of the working class broke down because they were regarded as having been bourgeoisified, and so the capitalists saw no threat to the overall system. In fact, the threat that they saw was full employment, because full employment was making people rather uppity. And so you had a lot of talk, by the 1980s in the NAIRU, the NAIRU. Does anybody here know what that is? No, it's not surprising, and most people wouldn't know. But it was very important to all the central banks. It was the non-accelerating inflation rate of unemployment. What the hell does that mean? Well, put in plain English, the non-accelerating inflation rate of unemployment is that rate of unemployment that will scare people who are in work to accept what employers are offering them because they'll be afraid of being unemployed. So two things are required for that. One is a sufficient rate of unemployment to make people afraid of becoming unemployed. And secondly is cuts in social assistance, cuts in unemployment insurance, so that being unemployed doesn't look so scary. Because if being unemployed for a period or your whole life even isn't so horrible, you still have the basics, then people aren't going to be afraid of being unemployed, and they're going to continue to demand more from employers and not treat employers with respect that employers thought they believed. So it became very important to be cutting the welfare state, and that's still going on. And there's an incredible irony in all this because, again, there was the revival of the idea that the unemployed were unemployed because they were lazy, when in fact they were the soldiers against inflation, and their unemployment was required by the state that was created through monetary and fiscal policy. Anyway, so also because most social workers were women, there was a strongly felt need in a sexist society to not blow the respectability, credibility, and gradually better wages that the profession had been able to win by appearing compassionate, but without scaring the ruling class. So whether it's the Canadian Welfare Council, which later becomes the Canadian Council of Social Development, provincial or local welfare councils, or the Canadian Association of Social Workers, that one studies for the period before about 1980, it's striking that mention of social class, publicly or privately, is glaringly absent. So is any meaningful discussion of race or of Indigenous rights. The focus on adaptability of individuals to a Canadian society, which social workers wanted to improve via state action, but which social workers implicitly accepted as having basically good social values and providing opportunities for advancement for most people, easily outweighed tendencies to Marxist or other radical critical perspectives. Even those who had those perspectives tended to hide them. There was certainly a social democratic tone, nonetheless, to the dominant social work perspectives, but of a Cold War variety, not the more threatening pre-war kind. They weren't calling for nationalization of industry. They were basically calling for social programs that could be tacked on to the existing free enterprise society. But as we'll see, popular organizations formed in which oppressed groups deigned to speak for themselves, and this created some new challenges for social workers in their own self-identity and their understanding of Canadian society. That doesn't really happen to any great extent until the late 60s. So let's look at the various kinds of programs that social workers created, supported. Starting with pensions. The Canadian Welfare Council, once it was no longer burdened by Charlotte Whitman's conservatism, became a staunch supporter of comprehensive social insurance measures, and defended them mostly in the utilitarian language of Keynesianism that denied any intended threat to the capitalist system. Now, its presentation, for example, to the Dominion Provincial Conference on Social Security in March 1946, while more of a list of desirable programs than a carefully argued and integrated plan, demonstrated the hope that the Canadian government would follow what Britain was doing in introducing a whole bunch of social programs. So there was that kind of support. But there's this terrible desire not to sound radical about things and to put things forward in ways that seem to be acceptable to the ruling parties and the bourgeoisie of the country. So, for example, at the Parliamentary Committee on Old Age Security in April 1950, which was looking at the question of whether we would have a universal pension in Canada. We had a means-tested pension at that point, which just went to the most destitute of people. But so the CWC argued like this: most people today work for wages, and the statistics show for relatively small wages. So that was a good argument. The objection that such measures designed to provide merely for minimal needs sap personal initiative and resourcefulness does not stand up under analysis. On the contrary, experience demonstrates that well-planned social security programs, by helping to remove the paralyzing fear of unemployment, old age, and serious or prolonged illness, actually increase the individual's productivity and usefulness to the community. Such programs support consumption, and thus the demand for goods and services, by putting a floor under the incomes of thousands of people who are more certain than any other group to spend the additional income. The long-run problem is one of utilizing fully the productive capacity of the nation, and to this end, consumption patterns must be maintained at a high level, and they have to be stimulated by state action. So, this is it's an argument for progressive programs, but using a kind of conservative argument that, well, you give a little bit more money to the poor, they'll spend it, and that stimulates business. So, in the case of seniors, the CWC based its recommendations on a survey that had asked 22 social agencies across Canada to conduct to price the foods recommended by the Canadian Nutrition Council in quantities determined by the Welfare Council of Greater Toronto. Several agencies also used casework to sample the rents of their pensioner clients for acceptable lodgings. And then the CWC, the Canadian Welfare Council, factored in the Toronto Welfare Council's calculation for necessary clothing and personal care. And so it noted that the maximum $40 per pensioner that was the means tested pension at the time it leaves no provision for medical costs, burial fund, cleaning materials, housing replacement. So it was very bare. And now, by 1950, almost everybody in the country, including the business groups, did support, getting rid of the means test. But the way in which business wanted to do it was to take the $40 pension that was means tested, reduce it to $30, and then you give it to everybody. And so there wouldn't be that much increased cost. So CWC opposed that and argued instead, they did support a pay-as-you-go flat rate, but they wanted it to be much higher, though they weren't clear how high. They said the amount of the pension should be sufficient to provide a minimum standard of living for the great majority of beneficiaries. And now, a flat rate pension actually is more equitable than a contributions-based pension, like the Canada Pension Plan. A flat rate pension, because unlike flat rate pension, the CPP means the greater the payments that you make into the thing, the greater the payments received upon retirement. So if you spend a fair number of years out of the labor force, as in that period in particular was the case, still often the case for many women, you are discriminated against when you retire, or if you just never make a good wage, you're discriminated against. But a flat rate pension doesn't have that kind of discrimination. So the CWC provided a mealy-mouthed explanation for favoring the flat rate pension, suggesting only that the flat pension offered, quote, an open and above-board system, unquote, where, quote, government subsidies are not concealed, as is often the case under contributory plans, which create the false impression that beneficiaries have provided for themselves, unquote. And you wonder, well, why don't they just say that we think all old people should get, the same amount of money from government, and it should be enough to look after themselves. So instead they come up with this more technical kind of thing. In the end, actually, the Liberal government wasn't prepared to accept the social workers' view that the government had to provide every senior with a sufficient standard of living to allow them to meet all their needs. Though not agreeing to the business call for pensions to be cut so that the government need not raise extra revenue, as they made the pension universal, so they did leave it at $40, in other words. They also ignored the CWC call for an increase in the pension that would allow pensioners with only their government pension to live on to be able to meet all their needs, if only in a limited way. So actually, so until the 1970s, about 40% of pensioners, even by 1970, were living under the poverty line. Similarly, CWC's position, first on view in their report to the Dominion Provincial Conference on Social Security in 1946, that universal pensions should begin at age 65, with means-tested pensions at age 60, was ignored in favor of a universal pension at age 70. Gradually, that was reduced to 65, but in 1951, you couldn't collect until 70, and actually most people didn't live till 70 in those days. So anyway, moving on to housing now. So the CWC and other social agencies generally offered similarly liberal rhetoric in favor of greater government intervention in the area of housing policy in an effort to stress that they placed limits on how far government housing policy should go from regarding housing as a commodity to regarding housing as a social right. During the war, there was an advisory committee on reconstruction, and it had a subcommittee on housing. And that subcommittee on housing looked at the state of housing across the country, and it concluded that after the war, at least a quarter of all housing built should be in the public sector, because otherwise you were never going to catch up to the actual needs. There was a very large percentage of people living in substandard housing, or living in housing that took so much of their rent that they could barely eat. So the only way to deal with that was to build a lot of public housing. The federal government largely rejected that perspective and focused upon making private home ownership more attractive for Canadians. That meant mortgage guarantees for for private single-family homes rather than rent subsidies for publicly owned apartment buildings and row houses. Wartime housing enterprises, which had built about 50,000 housing units during and immediately after World War II, was told to wind it up, sell those places, and don't build anything more. So the social agencies across the country wanted the report that had been done during the war to be implemented, the so-called Curtis Report, after the fellow who was in charge of it. So they put pressure on the Canadian Welfare Council to lead a national effort to persuade governments, particularly the federal government, to fund, as Charles Young, executive director of the Montreal Council of Social Agencies put it, quote, a Dominion drive for government-subsidized housing for low-income groups, unquote. Young indicated, quote, as a local community council, we endeavor to stimulate public concern and official action, but there are serious limits to what can be done on the municipal level, especially in this part of the Dominion. And really what that was all about was, in Quebec in that period, you had the Union Nationale government, which was essentially linked very closely with the Catholic Church. The Catholic Church in Quebec was fascist. It was against social policy. When I say they're fascist, I don't mean to use fascist just as a pejorative word. I mean that they were fascists. They supported fascism in the 1930s. And they pushed an ideology of, the family, and basically, wanted the government to stay out of social policy altogether, as it did, pretty much in Quebec during that period. The Catholic Church controlled health, it controlled social policy, it controlled health. Everything was in the hands of the church. I don't like, what the Quebec government has just done in terms of going after Muslim women who cover their faces. But I do understand where some of those ideas come from. People were really, really impressed by the Catholic Church. During the Quiet Revolution, in a way, a certain mask was taken off, because all sorts of people had pretended to be very religious Catholics. It turned out not really to believe in the faith. And the church had done itself a disservice in a way, without wanting to either defend or attack Catholic teachings. Catholic teachings had very little to do with the power of the Catholic Church to get people into church. People came to church because if you didn't go to church, your kids would be denounced in school on Monday. And if you needed social assistance or you needed health services, they would be denied to you. So people put on a show of religion. And then when they were able to stop that show, they hated the church, many of them. So anyway, the CWC brief to Ottawa on housing in 1947 began by noting that, quote, the future health, vigor, and stability of the nation will depend greatly upon the housing conditions under which the people live and raise their children. The author suggested that even in normal times, only a third of Canadians could afford to buy new homes. And under the circumstances of the early post-war period, that had fallen to just a fifth of everybody. So it was necessary for the federal government, in partnership with the provinces and municipalities, to become the major builder of rental units in the country. So you would think, using that rhetoric, that they would support a radical solution, but they didn't. They wanted to wrap their support for new housing in Keynesian economics rather than bleeding heart social work. So they called for the building of public housing to be timed to occur during the next recession rather than right away. And what they said was, quote, if major economies in housing construction are to be achieved through the industrialization of the process of fabrication, it will be necessary to guarantee the housing market. For this reason, it is proposed that within the federal government's provisions of major construction projects to be undertaken during periods of economic recession, public housing should be regarded as one of the most essential elements. It must be pointed out, however, that in order to accomplish this purpose, will not be sufficient merely to keep public housing on the shelf. So the planning had to be there, but then the actual work would be done, when people were unemployed. So it was a very strange way of arguing for a compassionate policy. But, typical of that period, not just for social workers. But some local welfare councils wouldn't go along with this kind of thing. The Welfare Council of Greater Vancouver told the Department of Finance in June 1945 that there was an immediate need for civic housing authorities to be established that would implement low rental housing programs with federal subsidies. They wanted a housing authority to be established in Vancouver right away. And they said, quote, it should proceed at the earliest possible date with the development of an urban plan of low-cost rental apartment houses, as well as the development of a suburban plan of double and single-family dwellings, unquote. So in some areas of the country, the social agencies, social workers, took somewhat more radical positions. But the CWC and local council of agencies or social planning councils kept up the pressure as it became clear that the various levels of government intended to do very little in the areas of social housing and rent controls. So there was a very conscious decision on the part of the Canadian government after the war. They didn't want to build social housing. They wanted to subsidize people building private housing through the Canadian Mortgage and Housing. This ironically had consequences that they didn't intend. The only way that most people could even think of that was if both husband and wife worked, which was not something the government wanted, but it contributed to that. Now, we'll get to that when we talk about daycare. So the Toronto Welfare Council, despite opposition from business people, too bad, despite opposition from business people who participated on its board, published family budgets in 1949 that demonstrated that most families in the city didn't earn enough to meet a standard for minimum levels of health and self-respect. That budget, as the council suggested, devoted nothing to medical, dental, or hospital expenses, savings, insurance, or the purchase of furniture. So many people could never hope to buy their own home. So such pressures from a variety of sources did, in the 1960s and 1970s, lead to some public housing subsidies in Canada. Not much. And actually, when the NDP government in Manitoba, the NDP governments in Manitoba, Saskatchewan, and BC, along with Ontario's progressive conservative government, proved too willing to spend federal money to build social housing, a lot of the money was cut. So the CWC worked with establishment organizations to research housing needs, but it continued to put forward very conservative ideas about all this. In 1967, Michael Wheeler was the director of a project that the Canadian Welfare Council had produced with CMHC, said, a central premise of the present project is that the supply of low-income housing remains inadequate, largely because of public indifference to the problem. To change this situation will require, among other things, more effective presentation of existing information on the nature and extent of the problem, the acquisition and development of new knowledge and insights into the problem and its possible solutions, and the systematic promotion of attitude change among influential groups in the population. So again, the notion was that this is for the upper classes, where the social workers wanted to identify to make the changes. But about the same time, in a context of growing grassroots rebellion in Canada, low-income Canadians began organizing their own organizations, often after mobilization by the Company of Young Canadians or by non-governmental radical groups focused on poverty reduction. So social agencies have for years assumed the right to speak for marginalized Canadians, generally by trying to filter their problems uncovered by casework and empirical research within language that was acceptable to establishment forces. And that meant minimization of systemic causes of both inequality and poverty. Social planning councils, responding to pressures from below, did admit representatives of new organizations to their boards, at least for a while, and responded in sometimes confused ways in an effort to both retain their respectability with establishment forces while trying to maintain some credibility with the people they claim to represent. So the Social Planning Council in Metropolitan Toronto, for example, voted overwhelmingly in 1970 to permit direct involvement of the council in work with the poor and citizens groups. About 700 people had been mobilized by an anti-poverty group called the Just Society Movement to attend the meeting. Corporate representatives of the council were angry with social workers for their involvement with such groups, and were actually calling for firing some of the social workers who were most supportive of this kind of involvement of anti-poverty groups on the council. But Labour representatives threatened a full-scale withdrawal if such dismissals occurred. So that would make the council look too clearly corporate controlled. So the compromise that was reached between the corporate and Labour representatives was that the social workers could continue to offer advice and funds to community organizations, but could not serve as lobbyists for them. The Toronto Council came closest afterwards in playing the latter role in 1989 when it helped poor people's organizations to arrange a demonstration of 3,000. But significantly, the Ontario Campaign Against Poverty found that working within the constraints in the Social Planning Council limited their spontaneity and their ability to give control to the grassroots. So they formed the Ontario Coalition Against Poverty, which still exists, which is very different than social work organizations, is quite willing, to denounce the structures of corporate capitalism and to demand very significant kinds of changes. So anyway, there were a whole variety, though, of these groups that were forming in the late 60s. And their issues included social welfare and unemployment insurance rates, rent allowances, daycare facilities, investment in public transportation, investment in recreation, and involvement of low-income communities in development proposals that might affect affordability and quality of life in their communities. So these, and for example, the Lawrence Heights Advisory Council, which had over 1,000 members, had over 1,000 families as members, was responsible for sponsoring a daycare center, a grocery cooperative, hot lunch program, a youth orchestra, and neighborhood libraries. So the result of these popular organizations was that there was some change in the rhetoric from the social work-dominated organizations. And so, for example, in April 1970, in December of '69, a housing consultant, Michael O'Dane, moved away from the kind of language that Michael Wheeler had used just 2 years ago and said, public housing must be transferred from a program for poor people into simply a program for people. This can be done by building communities instead of ghettos, with adequate recreation facilities and play areas, by securing tenant participation and management. So, more and more the organizations tried to take in some of the demands of poor people, though not necessarily using their kind of language. Anyway, organizations of poor people raised issues that social service organizations might otherwise have overlooked. For example, the Lakehead Social Planning Council took up the cause of public housing tenants after hearing from the Tenants Association at Fort Williams LaSalle Place that their homes lacked soundproofing, laundry facilities, nearby stores, adequate bus service, and recreation for either children or adolescents. Meanwhile, bureaucratic rules forced guests to leave rental units by 11 p.m. So, this was important in terms of knowledge the social workers had, because earlier they would just call for social housing and not talk too much about what it would look like. Suddenly you had the people who were going to live in social housing, or already did, talking about the inadequacy of the stuff that was being built. Much the same can be said about in the area of daycare policy, where pressures from below changed social worker attitudes gradually in the post-war period. Before World War II, there was almost a national consensus that married women should not be working in the paid labor force, and that child raising was not only women's duty, but that it must happen in individualized households. There were feminists, particularly in the Western Canadian farm women's movement, defended the right of women to work. And charitable groups, generally with church affiliations, did provide some daycare for women whom they regarded as having to work in order to keep a household from absolute destitution. But there was there was also a built-in hypocrisy in the mother's allowance program, because I mean, you could only get mother's allowance in that period if you were a widow or a deserted wife. I mean, single moms got nothing. But the idea was that a widow shouldn't have to go out to work. But they actually gave them so little that they actually did have to go out to work. Social workers rarely challenged the consensus view of gender roles. And even after many married women entered the paid labor force during World War II, there was little disapproval suggested by social workers and social agencies when they were forced back into the home at war's end. But while social workers were not willing to make an absolute defense of a woman's right to choose to work, they often suggested that some women, for economic reasons, needed to work, and that provisions needed to be made to care for the children of those women while they were working. But actually, the Canadian Welfare Council during this period was much more conservative than some elected politicians. The communist MP for North Battleford, Doris Nielsen, said, you know, that it was not only a woman's right to work, but she talked about the emancipation of women as wage earners. Doris Nielsen, British Columbia CCF MLAs, Laura Jameson and Dorothy Steeves, also promoted this idea. You did have some people like Bessie Tazell, who was the executive secretary of the Welfare Council of Toronto. She was a committed leftist, and she did try to put forward through that council plans to dramatically expand daycare in the city, the federal and provincial governments. But overall, what social workers tried for was a kind of intermediary thing, where they wouldn't say that it was a woman's right to work, or that it was a good thing for women to have their own paychecks and, you know, their own ability to survive economically without a husband. So instead, what they tried to argue simply was, well, women are going out to work, so the children are what we have to focus on, because, you know, we can't stop them from working, you know, so we have to make sure that the children are well looked after. So the Toronto Social Planning Council summed up this argument in 1960. The real issue then is not whether mothers should work, but rather the need to ensure that children are cared for adequately while mothers are at work. So how are you going to persuade legislators that there's a problem? I mean, you know, working mothers are not complaining, actually. In fact, the surveys that were done in that period of whether people thought that women should have, should be working outside the home, so 93% of the population were against the idea of a married woman with kids being in the workforce. So that meant actually that even amongst married women with kids who were in the workforce, some of them were probably saying, no, they shouldn't be. But they just felt that personally they had to be. So in those circumstances, Joyce Rogers, who was Division Secretary of the Community Welfare Planning Council of Greater Winnipeg, decided that they would do a study using sampling techniques, and it was what they wanted to do was, quote, we want to point out that whether we like it or not, X% of mothers are working and Y children are affected by this phenomenon. These children are not to be forced to suffer from inadequate care because mothers are working. And so various studies of this kind were done. There was one in Vancouver, there was one in Ottawa, Calgary, Edmonton, Guelph, Hamilton, Montreal, Scarborough, Windsor, Chicoutimi, and Quebec City, all between 1964 and 1968. And all of them showed that working mothers were not able to get good care for their kids. In fact, the conditions in unlicensed childcare were quite bad. So anyway, the social workers' efforts to then portray the lack of good childcare options for working mother in conservative terms, even when they were making radical recommendations for publicly supported childcare for all working mothers, were sometimes glaring. Here, for example, the Ontario Association of Social Workers Western Branch, before the Royal Commission on the Status of Women in 1968, greatly expanded daycare service is an urgent need. They should be organized and operated as a utility service available to the total community with service readily available. So that's a very good position. And then working women cannot be expected to operate at their most effective level when the daycare facility is inadequate or non-existent. So suddenly the issue is, are women in the workforce productive enough? Emotional conflict for the woman can and does enter, resulting in a reduced level of proficiency in both her homework making and work in the community. Well-organized, licensed, and economical daycare centers could ensure the mother that her children are being well cared for. She will then be able to fill more adequately her various roles. So, the effort is to present a very utilitarian point of view. By contrast, that same year, in 1968, the Swedish government reported to the United Nations on the status of women. Every individual, irrespective of sex, shall have the same practical opportunities, this was their goal, shall have the same practical opportunities, not only for education and employment, but also in principle, the same responsibility for the upbringing of children and the upkeep of the home. Eventually, to achieve complete equality in these rights and obligations, a radical change in deep-rooted traditions and attitudes must be brought about among both women and men, and active steps must be taken by the community to encourage a change in the roles played by both. The view that women ought to be economically supported by marriage must be effectively refuted, also in the legislative field, as this view is a direct obstacle to the economic independence of women and their ability to compete on equal terms in the labor market. Similarly, the husband's traditional obligation to support his wife must be modified to constitute a responsibility shared with her for the support of the children. This concern for the children should also be manifested in a greater degree of participation, the supervision and care of the children on the husband's part. These are the kinds of issues that the Canadian social workers at that point largely didn't want to deal with because they wanted to be seen as, working inside an existing paradigm. However, at the very end of the 1960s, the Social Worker, the Journal of the Canadian Association of Social Workers, published an article in November 1968 that did defend a woman's right to work and to receive state aid for childcare while at work. So this was important because if you looked at the social worker before that point, they didn't raise the issue at all. Canadian Welfare, the journal of the CCSD, began to carry similar pieces about the same time. Nonetheless, the public views of the social work community largely clung to the defensive position that viewed publicly subsidized daycare in terms of helping children and the economy, rather than in terms of financial emancipation of women, or in terms of challenging patriarchal perspectives and gender roles inside and outside the home. The Ontario Welfare Council did publicly support the call of the Royal Commission for a public system of daycare open to all women who chose to work, with geared to income subsidies available. But they justified a universal daycare program with calls to use it to provide, quote, excellent opportunities for early identification of and assistance in relation to special needs and problems in the areas of health, family relations, and learning skills. So in other words, daycare should be seen as a chance to identify poor mothering. So the focus on identifying children and parents who needed social intervention rather than on the creation of gender equality smacked of efforts to boost the need for the skills of the social work profession. But before branding groups like the OWC that adopted conservative discourses regarding childcare, it's important to underline that from the end of the war onwards, social workers and social agencies increasingly moved in the direction of support for public financial support for all women who chose to work regardless of why they made that choice. So as conservative as the OWC's justification for universal daycare might be, it was still support for a radical program in terms of women's economic independence. So they hoped that by couching their support in terms of professional support for children, they could win support from legislators, at the time almost exclusively men, who might be leery of debates about gender equality, but who were concerned about child welfare. As a profession composed mostly of women, they tried to minimize the gender component that was crucial to the child care debate, in the hope that the societal debate could be turned away from women's right to work, where there didn't seem to be that degree of support that one might want, towards how to improve the quantity and quality of childcare services for working mothers. So the idea was to get in through the back door. Similarly, on the guaranteed annual income, the Canadian Council on Social Development and other social worker-dominated organizations were supportive of progressive action and gave the opinion that such a program would achieve societal efficiencies, much as they claimed for daycare. But they were not to be seen in the streets, along with the anti-poverty groups, demanding basic incomes, or to be heard suggesting that the poverty of many resulted from the excess of the few. So, getting to the end. In all of this, we see limits to how social workers and social work organizations that included corporate representatives and funders, or that depended on government subsidies and ability to work with elected politicians, which is most social workers, were willing and able to go and pursue social change. They were against public protest, for the most part, and were careful to focus on one demand at a time, rather than calling for uprooting of the capitalist system, or even a major modification in the distribution of wealth between capital and everyone else. They rarely talked about the taxation system in general, or in terms even of specific reforms that they were proposing. They acted as if a struggle between labor and capital was outside their understanding of how the world worked, and they made no reference to trade union rights, even when they were partnered with labor in lobbying on an issue, and even when they were members of trade unions themselves. Their activities and discourse looked pale compared to, say, the radical and still active Ontario Coalition Against Poverty, or the outspoken, if somewhat less radical, Vancouver Unemployed Citizens Welfare Improvement Council. That group held a demonstration in March 1970 against provincial workfare legislation. Their statement to Minister of Health and Welfare, Phil Gagliardi, included, quote, "We demand a recognition of the right to the necessities of life as being separate from the right to work. We demand to be recognized that people must have the right to refuse jobs which have no future, which do not meet union conditions, and which lack adequate pollution control devices without fear of cutoffs and other punitive action. We demand the immediate application of the guaranteed annual income tied to the fluctuation of the cost of living. For the present time, we consider $200 per adult and $60 per dependent child to be the minimum adequate sum." And in 1970, in most provinces, the minimum wage was $1.25 an hour. So what that organization was demanding was that a household with 2 adults and 2 children receive a guarantee of 2.5 times the income that a family at that time, dependent on wages of a single earner, could hope to amass. It's fairly radical. And the UCWIC had earlier told the Senate, it is not the unemployed worker who can be said to be on welfare, it is the fat drones. Then provided a long list of subsidies to mining companies and the dairy industry, amongst others. It called for wages for housewives and other caregivers, along with free daycare for children of women working outside the home, for a provincially operated cooperative supermarket, and for guaranteed work for all who wish to work, including the disabled and the elderly. So, last paragraph. While many social workers likely shared such radical sentiments, and some even wanted Red Revolution, their jobs, whether as caseworkers or community research and pressure group employees, made such bold statements out of bounds. They never attacked the subsidies that industry was getting, what David Lewis called corporate welfare. Nonetheless, while restricted to a discourse that accepted a capitalist system as a permanent construct and social change is gradual and empirical, Canada's social workers did contribute to social change in many areas, with their emphasis on the need for an intervention of the state. Social workers wanted governments to act compassionately, but generally seemed wedded to a utilitarian technical discourse rather than to a discourse of social obligation. They would be forced to be somewhat more oppositional in the neoliberal era, when the dominant paradigm shifted strongly against welfare liberalism. Even then, their dependence on the state and on charitable institutions and foundations supported by capital would continue to limit the degree to which social workers adopted oppositional stances. They were more likely to be unionized, and their unions were likely to be part of social justice coalitions, headed up by unions but involving other civil society groups. But in the period when the welfare state was expanding, they felt that they could only afford to focus on incrementalism to try to hide all hints of ideology or a critique of power relations within Canada and their impact on life chances for various groups of Canadians. Thank you. So, your turn now. Comments, questions about all this stuff? Don't be shy. I mean, you're a large portion of people here are social workers or people intending to become social workers. Does this seem like a fair characterization of limits placed on your profession? You know, that basically, radical has to be in quotes, because if you're radical, you are a bum and you're not going to work as a social worker. you might get a job in a social work faculty, because faculty are protected in ways that other people in society aren't. I know that. Actually, my first career was in journalism, and I was blacklisted because of the way I like to speak my mind. It's a fact, the person, I don't live in the real world, and I can talk in different ways about things. So what are the limits that social workers face? Is this kind of stuff where, basically you are calling for a degree of social change, but you phrase it in such, ways, be bowing to the master, and just say, well, do a little bit at a time. Well, don't build the houses now. Wait until the economy collapses, and then people need jobs, so they can be building houses for people who need them then. That kind of stuff. So, is that all there is? Yes. Over here. Yeah.
Your review period ends in 1980.
Yeah.
Could you comment more briefly around whether you're more optimistic or less optimistic in recent years around social workers' roles in social change?
Yeah, my observation is that social workers in the neoliberal period, that more of them have, particularly because they tend to be unionized now, have been more willing to speak out a bit. Now, it's not all social workers who speak out. It tends, in fact, to be union representatives and that. But that's still important. I mean, like, for example, in my province of Alberta, the president of the Alberta Union of Provincial Employees, Guy Smith, is a social worker. And he led a social workers strike in the early 90s against, two of them actually. One was against the inability of social workers to deal with their caseloads because they were too big. And he had social workers saying, very vocally that, in fact, we're not able to provide proper service because the caseloads are so big, and also because there's so little being done for the poor by the government of Alberta. Similarly, during the Klein cuts, which just made everything so much worse, social workers did play a prominent role, and many of them did speak out. So things have improved somewhat. I think there is still, though, almost built into it, a kind of Lady Bountiful stuff that hasn't gone away. So, but I mean, it is more common for social workers now, for example, to recognize the particular demands of indigenous communities, whereas in the period I'm talking about, the whole idea was take away their indigeneity, help them assimilate. The only difference between social workers and other groups would have been that whereas other groups that assimilate them to the larger society, where they'll be at the very bottom of things, a lot of social workers say, well, no, some of them should be trained to be social workers and doctors and that too, that kind of thing. So, so I think things have changed somewhat, but some of the same problems remain. If you're employed by the state, or you're employed by an agency that needs money from the state or gets its money from a corporate foundation, you got to be careful what you're saying, what you do, and that. I was on the board of the Edmonton Social Planning Council a few years back. I was very unimpressed with the way they approach social issues, because again, there was still this, incredible desire on the part of the social workers that, not to step over certain boundaries, Yes.
Dr. Finkel, there is if I understood your communication the way I think I did, my experience of your keynote is that you are a diplomatic, impatient individual. Because you speak of resistance and, entre guillemets, radicalism, right?
Mm-hmm.
Now you have before you about 120 individuals who are here because they have enthusiastically embraced or want to the profession of social work. And so I'm going to ask you the same question I asked Craig Fortier yesterday. How do you reconcile radicalism and the need to be gainfully employed?
Yeah, good question. Sure.
Social worker?
Well, I would say in part that first of all, to develop a radicalism that you're going to maintain, that you want to learn some of this kind of history that I'm giving you, and you want to learn about political economy. You want to learn how this country really works, as opposed to, you know, as Jeanette was talking about, you know, the Tim Hortons, you know, kind of version of this is what we celebrate. This is what the real world is all about, and that's the first thing, is to kind of understand this kind of stuff, and not to lose that understanding as you're dealing with people. In terms of, you know, whatever jobs you take, I mean, I wouldn't condemn any existing social worker job, but you do want to understand as you take these jobs what the limits are, and what you can achieve on the job, and what you have to achieve off the job, because of course you can be a militant and be a social worker. You don't have to do them at the same time necessarily. Can you on the job achieve certain things? Well, again, I guess it depends on where you're working. In terms of the various social agencies, the groups that you know, lobby governments, they should be taking more radical kinds of positions. In many cases, even if it would threaten their funding. If you're working, you know, with individuals as a caseworker, you should be also at the same time working with your fellow social workers, you know, to lobby on behalf of these people. The big problem in the period that I'm studying here, at least as I understand it, because of course I am not, and never have been a social worker, but as I understand it, in terms of the way in which a lot of people worked, they worked very much as individuals. You know, they worked with the people who were, you know, their part of their case files and that. They did talk to other social workers, but they didn't necessarily talk in a way about, you know, how do these kinds of problems that we've seen with these people, how do they add up in terms of the social structure, and what can we collectively be pushing for? So, yeah, it's true that if as an individual you're part of some radical organization, you might be fired. But generally speaking, if you're unionized, you're protected as long as you're doing your job in the way that the employer has set it out. So you can try to get the way those jobs are structured changed. It's not really within your control, but you can try through your unions to do that. Or, you know, through your unions you can be pushing in a public way for changes in the legislation and changes in the bureaucratic structures, that kind of stuff.